DRAFO evaluation. In this section, we are going to look at the appropriate way to evaluate your patient for a DRAFO. It is very important to note that in the process and based on the Owens approach, you must evaluate your patient in the position that they will be utilizing the orthosis. If your patient will be sitting in a wheelchair all day and will not be doing any standing, evaluate them sitting. If your patient is going to be doing some ambulation with the orthosis or a lot of ambulation with the orthosis, you must mimic a standing position to make sure all the tendons and everything are in the appropriate alignment that are required for that position. In this case, with an ambulated patient, we must evaluate them supine. With the knee in extension, the first thing we want to check is what is our first catch, or R1. What we do, hold your hand on the heel, place the heel vertical, dorsiflex the foot. What you are looking for is where the foot catches. That is R1. Second, you want to look at what you need to do to stabilize that hind foot in dorsiflexion. And because the hind foot and the forefoot are connected, you may need to supinate or pronate the forefoot to maintain that alignment. Once you find R1 and what you have to do with the supination-pronation angle, that position becomes fixed and locked. You need to mentally note that or document that for your casting procedure. When evaluating the hind foot-forefoot relationship, use the palm of your hand holding the calcaneus in vertical to see, as you rotate back and forth, what position gives you the most stability in the foot. Again, we are looking for a biomechanical lock, creating a terminal point at the navicular to stabilize it and preventing collapse. Most cases, a supinatory position, as you see here, is typically the most appropriate.